Heart failure is a major contributor to the global burden of cardiovascular disease, affecting over 55 million people worldwide. The prevalence of heart failure has doubled in just the last 3 decades, and in fact is the leading cause of hospitalization worldwide. Today, multiple drug therapies are available to slow the progression of disease, as well as prevent important cardiovascular events in people living with heart failure. Despite this, major unmet needs exist, such that the deployment of such therapies are unequal and wide disparities are present. Heart failure is often viewed as the final common pathway of cardiovascular conditions and thus has been relatively under-prioritized in global cardiovascular agendas because some may view it as inevitable. A new Lancet series aims to dispel this notion, reframing heart failure from one that is only treatable to one that is eminently predictable and preventable. This Lancet series puts forth an ambitious agenda to address the global burden of heart failure today.
Heart failure is one of the fastest growing global health challenges, affecting more than 50 million people today. If current trends continue, this epidemic could soon overwhelm communities and health systems worldwide. Despite the substantial advances that have occurred in the treatment of heart failure, this has prioritized our current approach to be reactive, waiting until symptoms appear. And what is urgently needed is a proactive shift from treatment to prioritizing the prevention of heart failure. And that is what we outline in this first paper. We define a new global framework built on 3 key steps: risk assessment, recognition of pre-heart failure as a distinct and actionable entity, and prevention that begins earlier in the life course. We now have powerful tools at our disposal: validated risk scores, biomarkers, point-of-care imaging with the transformative potential of AI that together can allow us to identify risk earlier, intervene more effectively, and prevent progression to heart failure. This is a pivotal moment for us. By shifting the landscape of heart failure care towards risk prediction and prevention, we have the opportunity to transform global health.
In the second part of our series, Prevention of Heart Failure After Myocardial Infarction, we review the longitudinal improvements in timely revascularization, systems of care for recognition and treatment of acute myocardial infarction, and pharmacotherapies that have led to stepwise reductions in risk of heart failure after an acute myocardial infarction. There have been several landmark clinical trials that have established the role of coronary revascularization, renin-angiotensin-aldosterone system inhibitors, beta blockers, and mineralocorticoid receptor antagonists to specifically reduce the risk of incident heart failure after myocardial infarction. Despite improvements in care after myocardial infarction, care disparities persist globally, and ischemic heart disease remains an important pathway to heart failure onset. There are several exciting opportunities for improvement further, including the role of digital health, including systems of care improvements further, as well as ongoing clinical trials in this field, and it's an exciting opportunity to further reduce the risk.
Heart failure is a frequent but under-recognized complication of other forms of cardiovascular disease like atrial fibrillation and myocardial infarction, but is also an under-recognized complication of chronic kidney disease and metabolic diseases like obesity and hypertension and diabetes. Mounting evidence has highlighted that cardiovascular disease, chronic kidney disease, and metabolic diseases are deeply interconnected. They have shared root causes and frequently interact in the same individual to worsen health outcomes. What these strongly shared mechanisms of disease underscores the critical opportunities for simultaneous prevention and treatment. Indeed, optimal treatment of cardiovascular disease, chronic kidney disease, and metabolic conditions has been shown to substantially reduce the new onset of heart failure. As such, early detection and treatment of cardiovascular, kidney, and metabolic conditions, combined with systematic prevention and treatment of their upstream risk factors, should be considered primary targets for heart failure prevention efforts across the lifespan. In paper 3 of the Lancet Series on heart failure prevention, we illustrate that positioning heart failure prevention in the broader context of cardiovascular and kidney and metabolic health presents an actionable framework for patients, for healthcare professionals, for health systems, communities, policymakers, and other stakeholders.
Heart failure has emerged as a public health crisis worldwide, and concerted efforts are required to reduce its burden. We are proud as the World Heart Federation to endorse the Lancet Series on heart failure, to join the global call to move upstream to earlier diagnosis, risk stratification, and prevention of heart failure.